Good morning. In case anyone doesn't know anyone who's here today, from my far right, Dr. Malatras, who's not really a doctor, Dr. Zucker, who is really a doctor. To my left, Melissa DeRosa, Secretary to the Governor. To her left, Robert Mejica, Budget Director. Let's give you some facts today. My man, Sergeant Joe Friday, just the facts, ma'am. My daughters say nobody understands who Joe Friday is. That's their mistake. Dragnet was an underappreciated cinematic treasure, in my opinion. Joe Friday, just the facts, just the facts. Here are just the facts. Hospitalization rate is down from 18,000 to 17,000 mark. That is good news. Total hospitalizations down. We talk about the flattening of the curve, the apex. How long is it flat? When does it start to curve? We don't know, but this is a good sign today. If you look at the net change in hospitalizations, it's down more significantly than it has been, so that's positive news. 3-day average, which again is more accurate than the day-to-day counts. I'm a little skeptical about the day-to-day counts. This is all a new reporting system, but the 3-day average is more reliable. ICU admissions number is also down significantly for the first time, so that's good news. Intubations is down, and that's really good news because the intubations ultimately lead to the worst news. 80% roughly of people who get intubated never come off the ventilator. The number of new people who are diagnosed with COVID, about 2,000 still yesterday. So when you see the reduction in rates, remember what we're talking about. We're talking about a reduction in increases. You still have 2,000 people every day about who are walking into a hospital for the first time or who are being diagnosed with COVID for the first time. And 2,000 is still a lot of people. But the good news is it means we can control the virus, right? We can control the spread. And we did not know for sure that we could do that. We speculated that we could do it, but we didn't know. So now we know that we can control this disease. The bad news is 2,000 people walked into a hospital yesterday for the first time with the disease, and the worst news is 600 people died yesterday from the disease. That is still continuing at a really tragic rate. Of those deaths, 577 in hospitals, 29 in nursing homes. We've been watching the nursing homes because nursing homes in many ways are ground zero for this situation. Last night, the number in nursing homes was relatively low. Everyone asks the same two questions: when is it over? And how do we get there? How do we start to make our way from here to there? When is it over? As I've said, when is it finally over? It's over when you have a vaccine, and that's 12 months to 18 months. We've said to the FDA, any way we can be helpful in the testing of that vaccine, how do we accelerate that? How do we expedite it? New York is ready, willing, and able to do that with the FDA. Maybe there's a medical treatment between now and the vaccine. That would be great. But those are unknowns, and it's out of our bailiwick. We are working with a lot of companies that are working on treatments. We're testing treatments in our hospitals, but that's a pure medical research and development function, which is beyond us. At the same time, how do we unpause New York? New York is now on pause. How do we unpause it? First, do no harm. Don't let that infection rate go up to the best of your ability. Don't lose the progress that you have made. Second, now go back that we have some stability and we can actually work with the healthcare system, which we had on overdrive for many, many weeks, And we had increased the capacity, as you remember. Every hospital had to increase capacity 50%. I mean, just think about that. 50% more beds, staffing those beds during this horrific period. Now we have a chance to be more intelligent, frankly, about handling our healthcare system. Testing and tracing, testing and tracing, testing and tracing, and we need the federal government to work with us on that. And then phasing an economic return to the quote-unquote new normal, right? Those are all activities that are going on at the same time, and that's our plan to quote-unquote unpause New York. You stopped everything. How do you now restart that machine in a coordinated way that doesn't drive up the infection rate? That's the balance that we're trying to strike. On unpausing and having businesses open, that is a nuanced question. There's no light switch. It's not all businesses go back tomorrow. It's what businesses, what do they do, what risks do they pose, and what changes can they make in their business to make them more safe. You know, this is not just government deciding. It's government deciding with private businesses who now have to take a look at this new normal, this new reality, and tell us how they think they can adjust to it. One of our questions in evaluations is, how essential is that business service, right? You have to start somewhere. Right now we have the economy working with what are quote-unquote essential workers. That's why the grocery store is open. That's why public transit is running. All right, so we want to start to bring the economy back, move up one tranche on how you define essential. What's the next level of essential businesses? Are there certain businesses that are inherently safer or can be safer? And then let's talk about how we reopen them and where we reopen them. And these are all questions that we have to work through on a case-by-case basis. But there is a matrix. And the matrix is how important is the business to society, how essential a service, and how risky is that business from a rate of infection. And obviously, the more essential a business, the lower the risk, the more they are a priority. And then how do you do it? You do it in phases of priority, and then you phase it up the way we phased it down, which is by percentages. And this is going to be an ongoing process over the coming weeks that we're working through with the other states. But the what, the how, the when, looking at how important that business is and what the risk that business poses, and then do it in coordination with our other states, because this is really a regional issue, and it should be addressed on that basis. Coordinating with the other states doesn't mean we'll always be in lockstep, but we'll talk through everything first, and hopefully we're not doing something that's contradictory to another state at a minimum. And so far, so good on that exercise. And that analysis is ongoing. But it's not going to be all about what government does, what government does. The private sector now has to think about what they do and how they do it and how they can do it differently in this new normal. Reimagine your workplace. And we learned a lot through this situation. People worked from home. Well, how many people can continue to work from home and the business still work? How do you socially distance in the workplace? Can you socially distance in your workplace? What are your new normal procedures and practices? How do you think you're going to get workers back and forth? And what precautions would you take? In the workplace, how would people work, and where would they sit, or where would they stand? And how do you do it without conference meetings? And how do you do it without gatherings? How are you going to interact with the public in a way that keeps the public safe, right? We're talking about businesses that pose a lower risk, tell us how you intend to organize and conduct your business. And can you do it in a way that poses a lower risk? And what would you do with your workforce to make sure if an infection happens that we can jump on it quickly? And then as we're going through all this planning, this is going to be a moment of transformation for society. And we paid a very high price for it. But how do we learn the lessons so that this new normal is a better New York? And there are lessons that we must learn from this because we do need to do things differently, or we can do things differently, and we can do things better. Part of the way across that bridge is testing. It is the single best tool to inform decisions and to calibrate all of this. This new testing world is a new frontier for all of us. New York State has been very aggressive about doing testing. We set a very ambitious goal when we began, and I'm happy to say they did it. We've done 500,000 tests in 30 days. That's more than California, Florida, and Michigan combined. And this is all about figuring it out first and taking a system that frankly didn't exist and creating this testing system and this testing regimen. 500,000 tests in 1 month. That sounds great, and it was great. It was a great accomplishment. And congratulations to everyone who put it together. But when you think of 500,000 tests in 1 month, and then you compare it to the fact that you have 19 million people in the state, you have 9 million workers, the 500,000 doesn't sound so big, right? So we have many questions to answer. Where do you test? How do you get the supplies? How do you coordinate the private labs? How do you coordinate the demand going to these private labs, right? Everybody wants testing. Private sector companies are calling for testing, and they're going right to the labs. Everyone is going right to these labs, and 50 states are competing, and the federal government is buying product from these labs. This has to be figured out, and it can only be figured out in partnership with the federal government. On top of that, once you go from testing, you have to trace every person who comes up positive. Trace means investigate. Investigate all those prior contacts. And then one contact, you test that person, leads you to another person. So the tracing investigators are really assembling an army that does not now exist. I spoke to the White House again this morning about it. I understand that this is a problematic area and the federal government's not eager to get involved in testing. I get that, but the plain reality here is we have to do it in partnership with the federal government. You're talking about supply chains that go back to China. A state does not have the capacity to do that. And there's no reason why you would have 50 states each trying to figure this out on their own, competing with the federal government, competing with the private sector. So I'm very much looking forward to the federal government's willingness to tackle this, understanding that it will be imperfect at best. But if we work together, we can do better than any of us could do alone. And that's what this is all about. You're not going to achieve optimum performance. You can't put together this national system with perfection. So people are understandably reluctant to get involved. But understanding the risk and understanding that it's never going to be done perfectly, if we work together, we can do better. And that's what we have to actually accomplish. We have to strengthen the healthcare system. Our surge in flex, which is the first time we've ever called upon all these hospitals to work together and coordinate. Every hospital was basically its own enterprise. and then we go back and say, well, you all have to work together and coordinate, and we're going to help you coordinate. It was first time that's ever happened. We understand about a stockpile like we've never understood before. We understand about sharing resources like we've never understood before. And we understand about sharing among states and how good people were to New York when we needed it, and states stepping up and sending us ventilators. And I said, New Yorkers don't forget, and New Yorkers are the most generous and most gracious, and we'll be there when people need help. New Jersey is still looking at their curve rising. The wave hasn't crested in New Jersey. They're our neighbors. Anything we can do to help. I've told Governor Murphy all he has to do is ask. We're here, and we're going to send 100 ventilators to New Jersey. But the key to all of this, the calibration, is the infection rate. And this gets a little technical, but I need people to really understand this. Why don't you open tomorrow? Because we're afraid the infection rate will go up. And everything we've been doing is to slow the infection rate. Well, how do you track the infection rate? We don't. We don't track infection rates. We see hospitalization rates, which are different. A hospitalization rate is a person who got infected and became seriously ill, so they had to go to the hospital. But we don't know how many people have been infected or are getting infected. We only know at this point how many people walk into a hospital, okay? Or how many people get tested in a nursing home. If you have advanced testing, then you'll have a better idea what % of your population has actually been exposed. That's what the antibody testing is all about. But the key is, as you're making this calibration on the reopening of the economy, as you're bringing more people out of their homes, how fast is that virus spreading, and how quickly is that infection rate rising, right? Dr. Fauci said early on that this virus spreads. It does it very well. And we know that, and we've learned it the hard way. The rate of infection is everything, okay? All those early projection models assumed a higher rate of infection, a higher rate of spread. That's why they were calling for so many more hospital beds, many more mortalities, because they projected a higher rate of spread. That has not happened so far. Caveat, so far. We've controlled the beast. We've brought the rate of spread down. If their rate of spread actually happened, we would have been in a much, much worse situation, and we would have been in a really bad place. I mean, their projections were staggering, and it didn't happen because we slowed the models. But remember what they were talking about. CDC, which is supposed to be the preeminent source, 160 million to 214 million people infected, they were projecting. That was only March 13th. That's what the CDC was projecting. You know how many 160 to 214 million are? We only have 328 million people in the country. They were projecting more than half of the population, and maybe 2/3 of the population infected. And that was only a month ago. They were saying 2.4 million people to 21 million people would be hospitalized. You know how many that is? We only have 900,000 hospital beds in the nation. They were saying, by their projection, a minimum of twice as many people would need hospital beds as we have hospital beds. Just imagine that. That was the CDC. The White House Coronavirus Task Force, the same thing. White House Coronavirus Task Force was saying 1.5 to 2.2 million deaths. Deaths. And that was the White House Coronavirus Task Force as of March 31, okay? Best case scenario, 100 to 240,000 with mitigation efforts. March 31, just over 2 weeks ago. So, and that's why all of these models said the same thing. They were all believing a higher infection rate. Now, and that's McKinsey, and that's Columbia, and that's Cornell, that's all of them. That's the Gates-funded model. They were all projecting a higher infection rate. We slowed the infection rate by our actions, and that's why we're in a better position today. Now, what does the infection rate mean? And I know this gets a little granular, but people have to understand it if they're going to understand why we need to do what we need to do. The infection rate is how many people does one person infect, okay? How fast is the virus spreading from one person to another? And they talk about the R0 factor. The R0 factor is the projected spread of the virus, okay? If one person infects less than one other person, the disease is on the decline. If one person basically infects one more person, the rate of spread is stable. I get infected, I infect one person infects one. When you have a really situation out of control is one person infects two people or more, because then the increase is just exponential, and that's fire through dry grass. This is what they were all trying to project, and this is what we have to control as we start to reopen the economy. We say, we turn the valve on the economy, we open a little bit, and we watch the meter, right? What's the meter? The meter is the hospitalization rate, or even better, the virus spread rate. So you start to turn that valve, you start to bring people out of their homes, you start to reopen businesses, you see that number going up, turn the valve back right away. And this is what we're trying to deal with going forward. And again, nobody has been here before, so we're trying to figure it out. If the virus spread increases to the place where one person infects two people, that is an outbreak. If one person is only infecting one other person, that is basically a stable increase. Ideally, one person is infecting less than one person, and that is a decline of the spread of the virus, and that's what we're shooting for. Just to belabor this one more point, where you've seen an outbreak epidemic spread, it's when one person is infecting more than one other person. That's when you're out of control. On the Diamond Princess cruise, the infection rate was one person infects 2.2 additional people. Wuhan was one person was infecting two people or three people. The 1918 pandemic, one person was infecting 1.5 to 2.8. On our severe projection, one person was infecting 1.4 to 1.8. On the moderate projection, one person was infecting 1.2 to 1.4, okay? What we've done, because of our mitigation efforts, social distancing, stay home, lock the door, we've brought it to less than 1. Our infection spread rate is 0.9, okay? Wuhan, which really closed down everything, and locked it up, Wuhan brought the infection rate down to 0.3, okay? So that's the range we're talking about. But when you think about that, we're at now 0.9, we only have a margin of error of 0.9 to 1.2. 1.2 takes you back to the high projection rate. We're at 0.9. That does not leave you a lot of wiggle room. So you're going to start to phase the reopening. You're at 0.9 now. After this entire close down, if you go to 1.2, you're going to have a problem again. So you see how narrow the window is. But New York pause has worked. The close down has worked. That's how we controlled the beast. That's how we got it down to 0.9. However, we're not there yet. We're just at 0.9. Again, Wuhan got down to 0.3. So we have to continue doing what we're doing. I'd like to see that infection rate get down even more. The New York pause policies, the close down policies, will be extended in coordination with other states to May 15th. I don't want to project beyond that period. That's about 1 month. 1 month is a long time. People need certainty and clarity so they can plan. I need a coordinated action plan with the other states. So 1 month, we'll continue the close down policies. What happens after then, I don't know. We will see depending on what the data shows. What does that mean? Tell me what our infection rate spread is. Is it 0.9? Is it 1? Is it 0.7? Tell me what the hospitalization rate is. And then the experts will tell us the best course of conduct based on that data. No political decisions, no emotional decisions, data and science. We're talking about human lives here. As relatively simple and possibly annoying as it seems, wearing a mask is one of the best things that we can do. And I understand I'm getting a lot of not happy phone calls off what I said yesterday about wearing a mask in public, but I'm sorry it makes people unhappy. I do not consider it a major burden, and it really is a simple measure that can save lives. And yes, people say it's a personal intrusion on them, but again, remember, it's not just about you, right? I have rights also, and my kids have rights, and your kids have rights, and you have a right for another person to take reasonable safeguards not to get infected. So the masks work. We said in public today, I'm going to include public transportation systems, private transportation carriers for hire vehicles, any operator of a public system, an operator of a private carrier, and for hire vehicles must wear a mask at all times. What does this mean? If you get on a bus, you need to wear a mask. If you get in a train, you need to wear a mask. If you get into a private car service, Uber, Lyft, the operator needs to wear a mask. If you get on a private bus, the operator needs to wear a mask, and you need to wear a mask on a private carrier. So is this inconvenient? Yes, but you're in a closed environment by definition. You're not socially distancing by definition. You're the front seat of a car to a back seat of a car. You're one seat in a bus to another seat in a bus. This is a precaution for everyone that I think balances individual liberties with a social conscience. This we're going to affect Friday, 8 p.m. Ultimately, what determines the rate of infection? You do, and I do. That's what this all comes down to, as simple as it sounds. It's not about government. It's not about anything else. It's about what people decide to do and what people have decided to do. They have brought this infection rate down. It's that simple. Nurses, doctors did a phenomenal job. First responders did a phenomenal job. Essential workers did a phenomenal job. But that rate came down because people changed their behavior. That's what happened. It is about the behavior of our people. It's that simple. It's our behavior. It's our level of discipline. It's how we educate our children. It's how considerate we are of others. What we're willing to do to safeguard others' health in our community. That's what makes all the difference on what we're doing. And it is the simple things. It's wearing a mask, it's washing your hands, it's the hand sanitizer, it's the social distance, it's making sure your children understand what to do, what not to do. It's all of these simple procedures that seem almost insignificant, but on a collective basis make all the difference in the world. And it is making smart choices. I want to get out of the house, I'm going crazy, I need to do this, I need to do this. I know, but be smart. Be smart. And engage what you're doing relative to everyone else and relative to the overall goal. But I will tell you, and I don't know that people truly appreciated this. I don't know that I did. Of all the unique aspects that we have learned going through this, the most positive and the most surprising to me has been how people have responded. The policies that I have communicated are not worth the paper they are printed on. I could stand up here as governor and say, we must do this, we must do this, we must do this. These are some of the most life-changing policies government has ever issued. Think about it. This is not government saying, here's your tax rate, here's age of voting. This is government saying, stay in your house, don't touch another person, wear a mask. Government, I don't even have the ability to enforce these measures on any scale if people said, I'm not willing to do it. These policies, which are difficult, which are life-changing, they are being implemented by people because people are choosing to do the right thing. It is that simple. And what this is all about today, the masks on transportation. I trust in New Yorkers. You know, I believe if the facts are presented to the people in this state, New Yorkers will do the right thing. What is the right thing? There's always a right thing. It is the appropriate path that is socially and morally correct. And New Yorkers have a very strong right thing quotient. They know what the right thing is when they hear it. And all I'm trying to do is give them the facts and the information to explain why I'm suggesting these actions. They decide whether or not to follow them. I can't put a mask on 17 million people. 17 million people will decide whether or not they'll do it. But they have done it because they have the facts, they have the information, they understand the risks, they understand the rewards, they understand the consequences, and what they have done has worked. And it's brought this state forward, and it'll bring this nation forward. And that's New Yorkers at their best. And that's because we are New York tough, and because New York tough is more complex than the word suggests. It's smart, it's united, it's disciplined, and it's loving. And New Yorkers have proven that time and time again, every day for 46 days.